Welcome to the best of PSA at ACR 2022 for Sunday today, November 13th, 2022. I'm Dr. Rachel Tate. I am here to represent Team PSA. I'm going to tell you who those people are because they are important and they have been giving you all of the information for roomnow.com for Team PSA. So I want to highlight their work. It's Doctors Orly Naj, Trish Harkins, Robert Chow, and Olga Petrina. I thank them for their dedication and check out their videos, of course, for highlighting other great works on psoriatic disease throughout ACR 2022 on our website. Without further ado, here are tonight's top two in PSA. Our first abstract tonight is by Dr. Gladman et al. It's from the Foremost study. This is abstract 1018. The objective of this particular study was to look at psoriatic arthritis disease phenotypes, including location, disease distribution, kind of other manifestations of the disease. The study looked at over 220 patients with less than 1 year of disease activity at the time of enrollment. Within the overall group, nearly 60% of these patients had more than one tender and swollen joint. Of those patients who only had one joint involved, approximately 40% of the aforementioned patients, the majority had small joint involvement, and as you would think, predominantly PIP joints. What they ultimately found is that despite the few number of joints involved in this particular early oligoarticular PSA patient population, those patients experienced high disease burden and impaired quality of life in terms of their HAQ-DI scores, their patient global scores, and their PSA scores. So despite the few numbers of swollen and tender joints involved. So why we think this is interesting and why you should know about it is that this study actually highlights the patient experience as it potentially diverges from the physician clinical assessment. And so it highlights our need for better understanding and really helping us to treat psoriatic disease as it is for our patients. Our next abstract is 1159. The aim of this particular study was to understand uveitis in psoriatic arthritis. This was a single center in Spain. It's with Dr. Vicente Del Mas et al. And the team studied over 400 psoriatic arthritis patients, and they discovered nearly 5% developed uveitis. Each of these cases, that 5%, they were acute. Over 80% of those patients were anterior and unilateral, and 50% of the patients had recurrence. The majority of the patients were found to be HLA-B27 who had uveitis. They had a history or active sacroiliitis and had elevated BASB and PSA scores at the time of uveitis. The incidence of uveitis before versus after biologic treatment was decreased in the TNF inhibitor group, with the exception of those patients treated with etanercept or patients who were treated with secukinumab, in which both instances were increased. So this begs the question, is the incidence really around 5%, or are we potentially treating preclinical uveitis risk with certain TNF inhibitors? As always, we have more questions than answers, but these are your clinical considerations from our psoriatic arthritis team. As always, follow me on Twitter @UpToTate, and I'm looking forward to tomorrow when we can meet again from Philly for roomnow.com from ACR 2022.